Dr. Davis, we're live. You may begin.
Thank you very much and good evening. And thanks to all of you for joining us tonight at our virtual town hall, Straight Focus on Vaccines. I'm Dr. Muntu Davis, the Los Angeles County Health Officer, and I'll be serving as your host and moderator this evening. And before we begin, I want to start by reading the Los Angeles County Land Acknowledgement. The County of Los Angeles recognizes that we occupy land originally and still inhabited and cared for by the Tongva, Tatakvian, Serrano, Quiche, and Chumash peoples. We honor and pay respect to their elders and descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, reconciliation, and to elevating the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native people and local tribal governments, including, in no particular order, the Fernandino Tatavian Band of Mission Indians, Gabrielino Tongva Indians of California Tribal Council, Gabrieleno Tongva San Gabriel Band of Mission Indians, Gabrieleno Band of Mission Indians, Quiche Nation, San Manuel Band of Mission Indians, and San Fernando Band of Mission Indians. To learn more about the First Peoples of Los Angeles County, please visit the Los Angeles City County Native American Indian Commission website at lanaic.lacounty.gov. Again, that's lanaic.lacounty.gov. Thank you. So let me start by saying it means a lot to see many of you here tonight focusing on health for yourselves, your families, and communities. Vaccines have done amazing things over many decades. They eliminated smallpox, nearly wiped out polio, and made diseases like measles and whooping cough rare in the United States. Now, that's not luck. Vaccines help prevent outbreaks before they start, protecting individuals and entire communities. As we head into the fall and winter, when viruses like COVID-19, influenza, RSV all spread more easily, vaccines remain one of our best tools to reduce the severe illness and hospitalization visits that can come from these infections. But we know this is also a confusing time. There's a flood of information, some helpful, some misleading, and it's not always easy to know what to trust. It's okay to have questions, a lot of people do. And science doesn't have every answer up front. It's used to learn and improve as new evidence becomes available. And that's why guidance sometimes changes. Not because it's unreliable, but because we're adapting to what we learn and what works best to keep people safe. That's also why gatherings like this matter. They give us a chance to hear directly from trusted doctors and experts, not algorithms and influencers. Many people are asking what is safe, what's new this year, what's still recommended. These are all valid and important questions, especially for parents and caregivers. That's why we're here tonight, to share clear, reliable information based on research, real-world data, and how vaccines are performing in communities. You may have heard of VAERS, the Vaccine Adverse Event Reporting System. It's one of the ways we monitor vaccine safety in the United States. Anyone, including doctors, nurses, and the public, can report things that happen after vaccination. But it's important to know a report doesn't mean that the vaccine caused the issue. VAERS is an early warning system used alongside other tools and large data sets to look for patterns and make sure vaccines remain safe for everyone. Our goal is simple: to support you and your healthcare providers by offering up-to-date, evidence-based information to help you make informed choices. Vaccines are safe, effective, and accessible, no matter your insurance or income. And right here in Los Angeles County, there are places you can get vaccinated at no cost. At the end of the day, the choice is yours. We just want to make sure you have the clearest, most useful information to make the decision that feels right for you and your loved ones. And remember, vaccination doesn't just protect you. It protects the people around you, your grandparents, coworkers, friends with health conditions, and your children. Here's how tonight's event will go. We'll start with brief presentations from two experts, one focused in on what's new this vaccine season, and the other on pediatric vaccines. Then we'll open it up to your questions, both ones submitted ahead of time and the ones coming in through the YouTube chat. If you'd like to listen in Spanish, interpretation is available now by calling 1-800-805-1150. Para escuchar en español, por favor, llame al 1-800-805-1150. Now, we also want to thank our many healthcare and community partners who've helped make tonight's discussion possible and who contribute working every day to ensure accurate information and equitable access to vaccines for everyone in Los Angeles County. First, I'll be pleased to introduce Dr. Nava Yeganeh. Dr. Yeganeh is the Director of Vaccine Preventable Diseases at Los Angeles County Department of Public Health. She leads countywide vaccination programs and monitors vaccine preventable disease trends to guide local policy and response. Dr. Yeganeh will provide updates on the new vaccine recommendations and what they mean for residents this season. Please take it away.
Thank you, Dr. Davis. I have some slides I wanted to share. I don't know if I can see the slides too. Oh, there they are. All right, great. Thank you so much. So I first wanted to start off with sharing some data on respiratory viruses this year, focusing on the three. We call them the big three because we have a lot of disease burden, but most importantly, because they've caused a lot of difficulties for humans, we actually have vaccines that can decrease the risk of having severe disease from these three viruses. So the slide shows the data comprised of test positivity as reported to us from Sentinel surveillance labs here in Los Angeles County. The bottom axis, the x-axis, is the weeks of the year, and the y-axis is the percent of tests that are positive. So what I want to point out is that in the green, you can see the COVID-19 positivity. And you can see that during the winter months, we didn't have a lot of COVID-19 positivity, but that we saw it actually peaking in late summer. I think a lot of us experienced this personally as well. It's been around, it's kind of peaked in August and it's going downwards, but there's still a lot of COVID-19 activity happening in LA County. And then in the blue, you can see the influenza positivity. You can see how there was a bimodal peak in the winter, but we don't see flu activity right now. And then RSV positivity is in the yellow. And again, you can see that in LA County, we don't have a lot of RSV happening now. So this is a perfect time to get protected. I do think that we have been seeing higher levels of RSV in other parts of the United States. So usually the South is when we see higher numbers. And then when they get it, usually about 3 or 4 weeks later, we'll see it. So definitely, I think RSV is coming sometime in late October, early November. So given this information, we should talk about how we can protect ourselves, given maybe some confusing messaging around vaccines. Next slide, please. So I do want to share some positive developments. On September 17, 2025, the Governor Newsom signed Assembly Bill 144. There's a lot of different parts of this bill, but the one I want to highlight is that it really shifts us away from looking at the CDC Advisory Committee on Immunization Practices to the California Department of Public Health. So this means from now on, we can really look towards science that has been vetted by our experts here in California, and the recommendations come from that science. And so this might actually differ from what the federal government recommends or the CDC recommends, but is really founded on expert opinion and really up-to-date science that's done by a lot of the experts in our great state. So that's the nice thing about this bill, is that it allows us to really rely on California Department of Public Health. And it also says that these recommended vaccines would then be covered by the California health plans. And that includes Medi-Cal managed care as well as HMOs. It also provides liability protection to providers, so providers can give these vaccines using the California Department of Public Health and not fear, some sort of repercussion. And finally, I think a lot of our vaccines are given by our pharmacy partners. So this bill allows pharmacists to independently initiate and counsel patients about vaccines if they're recommended by the California Department of Public Health. And that's for anyone 3 years of age and older. Next slide, please. So this slide goes over the recommendations, and I know it's a little bit busy. I wanted to really just kind of mention that the flu and RSV recommendations are very similar to what we had last year. So for flu, for the last decade, we've had that anyone 6 months of age and older should get their flu vaccine. And I have seen very positive news from the Southern Hemisphere that the flu vaccine effectiveness seems to be high, and we hope that we'll also have similarly high flu vaccine effectiveness. For RSV, the recommendations are again similar. So any infant who's younger than 8 months of age, whose birth parent has not received RSV vaccine, is eligible to get one of the RSV immunizations. And then any child 8 to 19 months who has risk factors can get the RSV immunizations. We also have RSV vaccines for 30 to 36 weeks gestational age. And then for adults, anyone who's 75 years of age and older should get one lifetime dose, and anyone who's 50 to 74 years with risk factors should also get doses. And then I want to shift over to COVID because I think that these recommendations are really important, and I really want to focus on kind of the last bullet point in almost every category. So it says all who choose protection. So anyone who chooses to get protected from COVID-19 is recommended to get the vaccine. So anyone who wants vaccine should get the vaccine. But there are specific groups that have the highest complications from COVID-19 infection. And so they're called out specifically. And that includes anyone who's 6 to 23 months of age, anyone who's 2 to 18 years of age who has risk factors for COVID-19, or who's taking care of someone who has risk factors for COVID-19. So that includes people like myself, who's a healthcare worker, or someone who's living with someone who has risk factors for COVID-19. And then anyone who's pregnant, planning pregnancy, so postpartum or lactating, and then anyone who is older than the age of 65 years. Next slide, please. So additionally, the Advisory Committee on Immunization Practices did meet September 18th and 19th. So this is the federal group that advises the Center for Disease Control. And they did have 2 different votes. Now, again, I want to emphasize that we are really following California Department of Public Health recommendations, but there are, I did think it was important to mark what is happening on the federal level. So just to give some context, they did vote on the MMRV vaccine. MMRV is measles, mumps, rubella, and varicella vaccine. So it's one vaccine product, one poke before different viruses that you're protected against. Before their vote, the ACIP had already had a preferential recommendation that said that anyone who's aged 1 should actually get these vaccine products separately. They should get MMR and varicella as separate doses because there's a slight risk of febrile seizures when you give the combined product. Now, this is a very slight risk. It's 1 in 3,000. So it's really, really uncommon, but there is that increased risk. There is a recognition, though, that some parents would prefer to get the combination dose because they would prefer 1 poke versus 2 pokes. So there was that flexibility that if parents had this choice and wanted to get it, they could do that. So after this vote, the vote is that, MMRV is no longer recommended for children under the age of 4. It can still be used for those 4 to 12 years of age. And again, there's no risk of increased febrile seizures for that age group. I think in general, this is a low impact vote because most providers in Los Angeles County, about 90% of providers were giving this vaccine separately. And California Department of Public Health has said, if parents still prefer to give that 1 injection versus the 2 injections, and they understand there's a small increased risk of febrile seizures, you can go ahead and give that dose as 1 dose. But just wanted to highlight this vote. It's just a little bit of confusion, but again, I think here as us in California, it really hasn't changed the way we need to practice. And if you still really want the MMRV as the first dose for your child, it should be available at your provider. Next slide. The second vote had to do with COVID-19 vaccine. There was a series of votes, and the recommendation really was that anyone who's age 65 years of age and older should receive vaccine based on individual-based decision-making, which is essentially that you should speak to your provider, who could be a nurse or doctor or pharmacist, and then anyone who's 6 months to 64 years of age should get the vaccine based on individual-based decision-making, with an emphasis on the risk-benefit discussion. So again, it suggests that people should speak to their doctor or nurse or pharmacist and make sure they understand the risks and benefits. And I think that's standard. So it's not really a big impact on us. The nice thing is that this means that the vaccine will be available through the Vaccine for Children's program. This is a program that provides vaccine for free for children who are uninsured, underinsured, or on Medi-Cal. Additionally, this means that the vaccine will be covered through the federal insurance programs like Medicare. Next slide, please. So this is just, all good news that, hopefully all of us should have access to all these vaccines. So hopefully RSV and flu vaccine will have been widely available all throughout the season to you, but now we should have additional access to COVID-19 vaccines, hopefully at both the providers' offices as well as pharmacies. We have touched base with most of our large chain and independent pharmacies, and they do have the vaccine available. Some of them are providing it to children as well. A lot of pediatricians will have it as well. I also want to emphasize that our Department of Public Health clinics do have limited amounts of COVID-19 vaccines really for uninsured and underinsured individuals. And we'll have the mobile vaccine clinics as well that will be posted on myturn.ca.gov. So if you go there, you can look specifically for sites that will be giving the vaccine to uninsured or underinsured people. For everyone else, if you go on our website, which is ph.lacounty.gov/vaccines, and you click where it says get vaccinated, you can get more information about places that have vaccines available. And I think with that, I'd like to hand it over to Dr. Gordon. Muntu, did you have an introduction?
Yeah, no problem. So yes, we'll hear from Dr. Bahareh Gordon. She's the interim chair of pediatrics at Olive View UCLA Medical Center. Dr. Gordon specializes in pediatric infectious diseases and works closely with families to promote preventive care for children. She'll share insights on pediatric vaccine safety, timing, and common parental concerns. Dr. Gordon?
Great. Thank you so much for having me. Again, I'm Dr. Bahareh Gordon. I'm a general pediatrician here in Los Angeles County, where I take care of kids from when they're newborns all the way through young adulthood. And like many of you on this webinar today, I'm also a parent. And I know that every decision we make for our kids, especially around vaccines, really comes from the same place, and that's love and wanting to protect them. So with that, I'm going to take a couple minutes to make a few remarks about what's new in childhood vaccines, touch on safety, and round it out with a few words on timing of vaccines as well. Dr. Yegena shared some of this already, so I'll just drive the point home. So what's new this year? There have been a few important updates that I think all parents should know about. The first is about the COVID-19 vaccine. So it's been updated for this season of our big three. And it's recommended again for everyone 6 months to 23 months old. And then above that, anybody with a risk factor, really frankly, anybody who's interested in having the COVID-19 vaccine. These vaccines have been fine-tuned to match the strains that are circulating now, kind of like how we update the flu shot every year. Another vaccine I wanted to talk about or another protective measure I wanted to talk about is RSV protection for babies. So this has been really new and exciting over the last couple of years, and parents have two ways to keep their infants safe. Pregnant people can get a vaccine during pregnancy that passes antibodies to the baby, or alternatively, newborns can receive a single antibody shot called Beyfortus after birth. RSV used to be one of the top reasons babies were hospitalized in the winter. And over the last couple seasons, we've seen a significant drop in hospitalization. So this has really been a game changer in pediatrics. And of course, it's just a good time to make sure your kids are caught up on routine vaccines like MMR, polio, DTaP, HPV, really those things that quietly protect our kids every day. So what about safety? In my clinic, parents ask me all the time, are all these shots really safe? And it's such a fair question. Every vaccine goes through years of research before it's ever given to a child. And it's really important to realize that safety monitoring continues long after approval through the system that Dr. Davis mentioned, VAERS. Side effects like a sore arm or a mild fever are actually really good signs that the immune system is working and learning to recognize the germs we're trying to protect your children from. Thankfully, serious reactions to vaccines are extremely rare, far rarer than the complications from the diseases we're preventing. And I want to share, I follow the exact same schedule for my own children that I recommend for my patients. And I do it because I've seen firsthand how well it works and how much it protects our kids. So another important question parents ask is about timing. Why does timing matter? And I think it's important to know that the vaccine schedule isn't random and it's not rushed. It's really built around when kids are most at risk and when their immune systems respond best. Each dose builds upon the last to create greater and stronger and long-lasting protection. And if your child's fallen behind, and a number of children did during COVID, don't worry. We can always catch up together. It's really never too late to start protecting your child. And so finally, the last thing I wanted to say is, as a pediatrician, I know that vaccines aren't just about medicine, they're about trust. When parents hesitate, it's typically because they care deeply and they just want to understand. And with that, my approach in my clinic, and I think the approach of most pediatricians, is to listen first. We want to know what's worrying you. Then I want to share what I've seen. Things like kids who kind of sail through flu season because they were protected, and others who've gotten really sick when they aren't. And honestly, I celebrate questions. Asking questions of your pediatrician does not make you anti-vaccine. It makes you a really thoughtful parent. My job as a pediatrician is to meet you where you are and help you feel confident in the choices that you're making. And so at the end of the day, like Dr. Davis mentioned, vaccines are about community. They protect not just your child, but newborns who may be in your home who are too young to be vaccinated, grandparents with weaker immune systems, and classmates with chronic diseases. So when you vaccinate your child, you're really doing something incredibly powerful. You're protecting them and you're helping keep everybody around them safe. And so with that, I'll end with thanking you for caring enough to be here tonight and for all the ways you show up for your kids.
Thank you both. I have a ton of questions here that I'm going to try to get through. I don't think we'll get through all of them, and I may mash a few together if they're touching on the same topic. As we talk about this, the real question is vaccinated or not. That's what we heard a lot of. And so, Dr. Yagane, I'd like to ask you, the question about, people who say natural immunity is better than vaccination, or why do we have to get another vaccination every year, if they work so well. So can you touch upon that? And Dr. Gordon, please add to that if you want.
Yeah, I think we're hearing a lot about vaccine fatigue. We've been getting, especially with COVID-19 and the pandemic, a lot of us were getting multiple shots, and plus we have the flu vaccine every year. So I do think that it is not something that it makes a lot of sense that people are asking that question. It's a good question, and so I think that the thing I would say is that unfortunately, the viruses are smart. They do change, they do mutate, and so we do need to kind of stay on top of it, and get our immune system primed for the next virus. Because if we don't, then we end up, we end up getting sick. We do see that there's this thing called waning immunity, where it doesn't happen right away, but over time, as the virus changes and as your immune system forgets how to fight it, you do need this other shot to kind of help your immune system remember how to fight against this infection. So I definitely do hear that there is a lot of fatigue, but I again would say that unfortunately we're not choosing to to fight this battle. This battle has been kind of, this virus is there, and it doesn't matter that we don't want to get more shots. We actually just have to do what we can to stay protected. I don't know, Dr. Gordon, what would you say?
Yeah, I would echo that. I think you took the words right out of my mouth that, we're not in the business of wanting to give shot after shot after shot, but we do it because we're trying to protect everybody as these viruses that we are working to protect people from are changing.
And then sorry, you asked about just natural immunity, and I do hear that a lot too. I think natural immunity, unfortunately, means that you have to get sick, and some people get very sick. Some people get hospitalized. Some people, we have hundreds of people die still from COVID-19. We have hundreds of people who die from flu. We have hundreds of people who die from RSV. I mean, we really are seeing really bad morbidity and mortality with these viruses. And so as someone who is an infectious disease doctor and worked in the ICU during the winters and seeing people come in, children coming in, extremely sick from flu, and having to have that conversation with families who were like, "Oh, I just never thought it would be this bad. I never, the flu is. I didn't think, I need to get the vaccine." It's heartbreaking, and so maybe there. Not that you don't get immunity from natural infection, but you do run that risk of getting really, really sick. And we see it, the reason that we are choosing these vaccines is because we know that they can make otherwise healthy people very, very sick. And we've seen it again with measles this past year. It's been devastating to see healthy children die from a virus that's vaccine preventable. So again, I'm not discrediting natural immunity, but I am saying that you run that risk of getting very, very sick, and your goal is to protect your children and your loved ones. So that's the reason I get everyone vaccinated in my family.
Could I add one? I just wanted to add one thing to that, specifically about influenza. This past influenza season, we saw nearly 260 pediatric deaths in the US, which is much higher than previous years. And of those, 90% of those children were not vaccinated, and over half of them were perfectly healthy children prior. And so, like Dr. Yagana said, I almost look forward every year to scheduling my family's influenza shots. My kids are actually getting theirs next week because while they're healthy, they're still at risk. And none of us want to see our kids sick, particularly very sick, and this very easy thing can protect them.
Thank you both. Dr. Gordon, just speaking about parents, and I agree with you, it's great when patients and parents ask questions. How do you talk to parents who feel overwhelmed by conflicting advice online about what their kids should do or what they should do related to vaccinations?
Yeah, so it can be so confusing. There is so much information online, and unfortunately, it's not all reliable. I mean, you can like scroll through Instagram or TikTok, and seven different people are telling you different things. And so, what I encourage parents to do is really focus on trusted sources. So, who are those people? Your pediatrician, the CDC, the American Academy of Pediatrics, really online sources that are not trying to sell anything. I think that's something that I often kind of have parents look out for. If the website is trying to sell you something, they may be biased in one way or the other. And again, as I mentioned before, bring these things to your pediatrician. Bring what you learned on TikTok, bring what you learned on the internet, and let's talk about it. My goal is always to listen first, and to understand what you've read helps me then have a conversation, rather than starting to overwhelm people with all of these facts that they may not be ready for.
Appreciate that. Dr. Yagana, anything you want to add from the public health perspective and giving advice to parents?
I think Dr. Gordon mentioned the importance of, having trusted sources that you can go to for information. I think that being curious is really important. I welcome these conversations. I love talking about vaccines. I think there's a lot that people go to the doctors for, and this is something that they're able to do. They're able to really help get to the bottom of whatever is concerning you. And again, I don't think anyone thinks these concerns are ridiculous. Like we all agree, our goal is to keep your child healthy, and we come from the same place. And a lot of the things that I hear from parents are really valid. And so I think, getting curious, asking your trusted sources, talking to your provider, and then really going through the evidence together and making a decision based on that.
Appreciate that. I think I would add in there is, we do hear a lot. And oftentimes I ask, well, where did you hear that? Or what is that based on? In order to really get a sense and context of where it came from in the first place. But definitely having discussions and, looking at, a number of sources and understanding where the concern came from is also important to keep in mind as well. So thank you both for that. There's a lot of questions that really, sort of go to the issue of changing advice, changing recommendations. A lot of this, I think, comes from, COVID, where, lots of things changed, not just related to vaccines and their availability and the recommendations, but, even in instructions. So I'll start by answering this a little bit by saying that, as we learn from science and we see things in the real world and data comes in related to that, advice and information changes. And I think as we went through the pandemic in particular, we may not have done, and we didn't do as good of a job in terms of explaining why things had changed. And so that's the important piece, is they're not random changes. They're really based on evidence and science, and usually strong evidence, not necessarily a weak study, a strong study with lots of information and data from across a number of different groups that help to discern what should change based on what we're seeing in reality at the moment. So as mentioned earlier, the science will evolve as new information and evidence comes in. And I think we have to do a better job at sort of explaining what changed and why the recommendation changed as well. And so expect that. It's happened over the course of our lives where recommendations have changed as we've gotten some real information in terms of what's happening, either with vaccines or with viruses or illnesses, that could be prevented by vaccines. The other thing that I will say is sometimes we think of vaccine as simply preventing illness, and that's not always the case. The biggest effect for vaccines is, in some instances, it will prevent it. We have some that do that very well. Others that really reduce the risk of getting sick or getting very sick, meaning being in the hospital or dying, from getting the infection. And so the benefits of that versus the risk and some of the side effects that may come, usually post-vaccination, like fever, sore arm, maybe feeling a bit run down, are really what we look at in terms of determining what recommendations, move forward as a larger society in terms of public health. Either of you want to add anything related to, changing information or updating recommendations? Because that is something that has come up often.
I think that we are trying to make information readily available to the public. Like we are trying to create dashboards where you can actually see the COVID-19 activity versus the flu activity. So, I think it is helpful to kind of look at this information because that's the information that's used to make recommendations. So looking at who gets the sickest with COVID-19 is how we choose to recommend COVID-19 vaccine for individuals. And so it is sometimes useful for us to make that information available to the public, especially if you're interested in this topic. And again, this is the kind of information that you could talk over with your provider, but it unfortunately it changes. Last year, COVID-19 it was very different than maybe the year before and the year before. So the recommendations do have to reflect that knowledge. We can't just stick with what we know. We have to use the science and evolve and hone our vaccine recommendations appropriately. So it is a changing landscape, and it is hard. And as someone who doesn't do this 24/7 for their living, to keep on top of all the recommendations, and we all appreciate that. We all know that. But yes, that's what I would say is we are trying to provide this evidence that for providers, for the public, in the world of public health, we are trying to make this more accessible. So it's not so much of a black box.
Yeah, thank you. So I would say in general, just expect that things are going to change over time as new information and good information becomes available. That's what's always happened. This is not anything new in our world, at least, and not in yours as well. Um, Dr. Gordon, let me go a little bit closer to home, in terms of parents. Parent gets their child vaccinated, the child experiences a reaction. When is it serious and what is normal, just in terms of that?
Yeah, so what's going to be normal is a sore arm, a fever. Those are going to be kind of our typical and mild reactions. Sometimes a bit of fussiness as well. For these situations, you can always do what we call supportive or comfort measures, maybe Tylenol, cool packs. No need to pre-medicate to prepare for these. But if those symptoms do come, and of course, always just a hug from mom and dad. So, again, like I mentioned before, serious reactions are extremely rare. Some that you may want to look out for, though, and really seek care immediately are going to be difficulty breathing, swelling of the face or throat, any persistent high fever. In those situations, you want to give your pediatrician a call or seek care immediately. Otherwise, for again, the low-grade fever, the sore arm or leg, and then the fussiness, you can typically manage those sorts of symptoms at home.
Thank you. Appreciate that. And I would say that some of the same is for adults as well. So, children are often no different than adults in terms of getting, some side effect or the body reacting a little bit once they get vaccinated. I will say one of the things that I've heard a lot is, I got vaccinated, then I got sick. I got the flu vaccine, then I got the flu. Can either of you want to take that in terms of what that actually means in terms of the vaccination and actually getting sick?
I'm happy to start. So I think there's a couple things. One, the flu vaccine, that the shot that we give you is not a live virus, so it cannot make you sick typically, but people still get the flu. So what are some reasons why that might happen? One, it could be that you were already exposed to influenza a couple days before you were vaccinated or during the time when the vaccine is working. Another is kind of, Dr. Davis, what you were mentioning before. Not every vaccine's sole purpose is to prevent the infection. It's really to prevent those complications. So, yes, if you get the flu vaccine, you may still contract influenza, but the likelihood of having very serious complications or complications at all from otitis media, ear infections in children, pneumonia, sinusitis, more serious things, including hospitalization or death, don't happen typically when you've been vaccinated and contract the flu after vaccine. So I would say you could still get sick. It's not because of the vaccine. And again, you're being protected from the very serious complications that you can have from actually getting influenza or whatever the other, whatever virus it is that we're trying to protect you from.
Thank you very much. Dr. Yagne, in public health, we're always watching across the county in terms of looking at vaccination rates and looking at illness as well. Can you talk a little bit about what happens when vaccine coverage, meaning the percent of people in an area within a community aren't vaccinated, and what happens when that starts to change or when it starts to drop?
Yeah, that's a good question. So it's a little bit different based on which vaccine we're talking about. There's some vaccines that are incredibly effective. And if you are able to get vaccination levels high enough, you can actually stop the spread of the virus. So, for example, measles, the MMR vaccine, is an incredibly effective vaccine. So if you are above 95%, you don't see it spread. It seems like it stops it kind of in its tracks. And we and most of the places in Los Angeles County have very high vaccine uptake for the MMR vaccine, and we've had multiple introductions, of measles in LA County, and we haven't seen an outbreak like they have in other states and other cities because we have really high measles coverage rates, measles vaccine coverage rates. So that's something, we call herd immunity or community immunity, and that works really well with measles. For other viruses that, you don't get that, you don't have that vaccine effectiveness that's quite as good. What you see is just more burden of disease. You see our hospitalizations go up. You see really difficulty with like making sure we have enough resources to take care of everyone as promptly as we hope. You see long waits in waiting rooms. And that's mostly what we see every winter. And we see that with influenza, we saw it with COVID, we see it with RSV and pediatrics. Whenever you have people who are not protected, you just have a huge volume of disease, and you get really sick people in the hospital waiting to be seen, and you have an overburdened health system. So I think we do experience that every winter, and then when we have really good vaccine coverage rates, we don't see that. And so really, the goal is to protect not only yourself, but your community. Because if I'm less likely to get flu, even if it's 50% less likely to get flu, that means that I'm 50% less likely to give it to my community, to my loved ones. And that means that it really keeps our resources, our medical resources, available to those who need it the most.
Thank you. This question, I have a couple of questions here that are really about the vaccines and components and how they were produced. So in particular, and I don't think it's just parents, I think there are also many adults who are concerned that, the COVID vaccine in particular was created too fast, or that the ingredients aren't safe. So can you talk to folks who may be thinking that, that the ingredients are not safe for their children, or that the vaccines were created too fast, and in general, there should be much more done before the vaccines are available.
Yeah. I can start, and then anyone else can dive in. So the way that all vaccine products are made is that they go through trials. So they have phase 1 trials, phase 2 trials, phase 3 trials. And so this is exactly the same way that the COVID-19 vaccine, those are the same trials that the COVID-19 vaccine underwent. And if many of us remember, initially there was like maybe 50 different products that were going through the system. So they were all in phase 1 trials together, and then some of them didn't work, and some of them made it to phase 2, and some of them, failed in phase 2, and some of them went to phase 3. So, all the vaccines did go through the same steps. COVID-19, of course, as we know, the federal government, not only ours, but every other federal government, was also very invested. So there was no resource spared. There was tons of money, tons of volunteers, lots of people volunteering to be a guinea pig for the COVID-19 vaccine, to enroll in these trials. And so that's why it was able to be developed so rapidly. Like, it was a military precise operation, and Operation Warp Speed did exactly what it was supposed to do. It was able to go through these phases quickly because there was no expense spared, unlimited money, unlimited funds. But that being said, that's the mRNA technology that ended up being the COVID-19 vaccine that we're using now was developed 10 years ago. It was developed for the first SARS-CoV epidemic that happened in Asia. So this is stuff that people have been working on and honing and perfecting. It was just ready to go because we expected that there would be such an event happening in our future, because it already had happened once, and there was no reason why it wouldn't happen again. So I kind of want to say that for COVID-19. I think many people don't realize that there's also a phase 4. Phase 4 is after licensure, and there's all sorts of safety analyses done. And it's done by the FDA, but we also have the CDC doing different safety monitoring systems. So there is actually ongoing evaluation. So once a vaccine is out there, we look and we see if there's any safety signals. And many of you remember early on, we had the Johnson & Johnson Janssen vaccine, and the phase 1, 2, and 3 trials, there was no safety signals. individuals, when it went to millions of people, there was a safety signal. And after, subsequently, the vaccine was taken off market. So these things do happen. But I just want to emphasize that, there is ongoing safety monitoring. And if there is a signal, it is brought forth, and the vaccine is either, there's additional information provided for people who get the vaccine, or the vaccine is taken off market if it's thought that the risks don't outweigh the benefits.
Questions?
Great. Dr. Gordon, can you talk a little bit about people who don't feel confident that the vaccines are safe, especially for young children?
Yes. So, I think one of the things that I hear most often from parents is concern over ingredients that are in vaccines. And so I think it's important to know that every ingredient in a vaccine is really there for a reason. To protect safety, stability, or effectiveness. And the amounts in the vaccine are very, very small. Additionally, all of those ingredients have been really extensively tested tested, but studied in children, sometimes for decades. And so, again, your pediatrician can go through the ingredients with you. They should go through them with you if you're feeling uncomfortable, so that you can understand them in detail. Similar to Dr. Yegan, I actually love having these conversations with families. I will say probably the ingredient that I have heard the most about as of late is thimerosal. So I think it's worth saying this is a preservative. It contains ethyl mercury, not the toxic methyl mercury that is found in some fish and is the one that we're often concerned about. There's extensive research that's been shown to have no link between thimerosal and vaccines and neurodevelopmental disorders or autism. And the reality is most pediatric vaccines today are thimerosal free or contain very trace amounts. And I think, again, maybe the strongest statement that I can make is I can tell you all of the science, I can tell you all of the data, and then I'll share that I trust these vaccines to give to my own children. And I have given them to my own children, to my nephews and nieces and family members. And so, again, I think what's important is making sure as a parent you're confident in this, and that confidence comes out when you can have a really open dialogue with your pediatrician.
Great. Thank you. This one is probably going to be a tough question because I don't think there's an easy answer. This is related to, sort of trusting, the messaging and, how do people know when information isn't being influenced by politics or by pharmaceutical companies? And I'll start out a little bit. I think a lot of it, again, is really about looking at where the information is coming from and also looking at what's behind it. I think Dr. Yegan talked about, the change in the MMRV vaccine in terms of separating the two. And the risk between those was really small, although important for some. And so having that ability of choice, understanding what that risk is really important in that regard. And so that choice was removed. Not based on new evidence, but just based on re-looking at the evidence and making a different decision in terms of removing that choice. I think at this point, there's a lot in many of the professional organizations like the American Academy of Pediatrics, the American Academy of Family Practitioners, as well as obstetrics and gynecology. They have all, sort of weighed in on the importance of vaccines. And I will say that each of those groups looks at the evidence, looks at the strong science and evidence related to those, and gives their recommendation. For people who have concerns whether or not they're influenced by pharmaceutical companies, many of them, you can see whether or not pharmaceutical companies are investing heavily in them or not. I believe the American Academy of Pediatrics put out their stats, and it's really not very doubtful that that's coming into play. And also, as we look at groups, you can often look at the groups who are providing the recommendations or doing the analysis, and many are required to disclose whether or not they have some potential conflicting, financial interest. And any person that gets put on an advisory panel is supposed to do that. Those questions are supposed to be asked in order to understand that as well. But there's just a lot of information. Information is not flowing as usual these days in terms of really going through these advisory bodies. Advisory body members have been changed on some federal organizations that have typically given recommendations. But it ends up boiling down to, really looking at where the information is coming from and understanding where the changes in terms of recommendations or thoughts, what's the basis for those. And the professional organizations, which are national in terms of the academies, are really trying to give recommendations that are best for the populations that they serve in order to prevent as much illness and serious illness and death from many of the things that can be prevented by vaccines as possible based on the evidence. Each time you get a medication, each time you get a vaccine, there's a requirement in the United States that you are given information on the risk and the benefits. So that allows you to look at that and make your choice in terms of what you want to do. So regardless of the recommendations that are there, you all ultimately have a choice, and you should be provided with information related to the risk and benefits, whether it's a medication, a prescription, or whether it's a vaccine. And you should always have the opportunity to ask questions. Any question that you want to ask related to it so that you can make your best choice in that. So you'll always have information in front of you and the opportunity to ask questions, whether it's on your own or at the time that you go to pick up a medication or a vaccine. So please keep that in mind as you look at that, as you look at information. But Dr. Gordon or Dr. Yeganeh, any thoughts related to politics and pharmaceutical companies and trusting and knowing that it's not influenced by those entities? As I said, it's a hard one.
That is a hard one. I'll just say kind of a couple things about it. Regulatory agencies and advisory committees really have to disclose conflict of interest. And they also need to rely on kind of multiple independent studies. And so as a general pediatrician, I can't blindly accept, what's being said. I really need to look at all of the evidence. And like you were saying, Dr. Davis, who funded it and whether independent groups can replicate the findings of that evidence as well. And so I know that the academy that I'm part of, the American Academy of Pediatrics, has very stringent ways that they evaluate data, that they put out recommendations. They have advisory boards of experts who have very transparently noted if they have conflicts of interest, those conflicts have been reconciled. And so that's what helps me trust the recommendations that are coming out. I don't know, Dr. Yeganeh, if you have other thoughts. This is a tough one.
Yeah, I think we're in an unusual time when, unfortunately, it seems like politics has gotten into vaccines, and it usually is not. It's not. The Advisory Committee on Immunization Practices has been around since the 1950s and hasn't had this kind of political stage before. And so I do feel like it is really, really important to know where people are coming from, what their biases may be. And I think, again, I would look at their training, their expertise, their body of work before, I would take their advice. So if it's someone who has been doing this work and working with pediatrics and working with infectious diseases and working with science versus someone who maybe has alternative reasons for potentially, posing an alternate schedule or an alternate product. So I do feel like it is an unfortunate situation where politics and science really shouldn't mesh. Science should science. It's an iterative process. It's based on people who are really interested in trying to figure out the best way to do something. And I really wish that there wasn't this weird marriage that we're seeing more of right now. I wish that they were separate again. But I do understand that right now it's an unusual time because there is a little bit of crossover. And I would recommend that you look at the expertise of the people you're trusting. I again would believe the American Academy of Pediatrics. I know as a pediatrician, we're always focused on the patient first, on the kids. We're not looking at anything except what's best for the child. If you are, someone who's immunocompromised, I would look at the IDSA, the Infectious Disease Society of America for recommendations. If you're pregnant, I would look to the ACOG, your OBGYNs, the American College of OBGYNs. So these are trusted sources that have demonstrated that they care mostly about their patients. So yeah, I agree that it's an unusual time.
So with that, and we'll take one more question after this one. Where do you recommend people look for locally for information in terms of recommendations if they're doing some research on their own, whether it's related to the county or the state? And as you mentioned earlier, Dr. Yeganeh, there's differences between what our state is doing and what ACIP has put out. So where should people look locally to find out trustworthy information?
We do have a webpage. I mentioned it before, ph.lacounty.gov/vaccines. That has a lot of our resources, a lot of our information about vaccines and vaccine preventable diseases. Your pediatrician, your family practice doctor, people who are you go to seek medical care, your pharmacist, they will often have information that they can relay to you. There's some national organizations that do a really good job. I really enjoy the CHOP, the Children's Hospital of Philadelphia vaccine pages. If you, for some reason, don't want to have a governmental agency like the LA County or California Department of Public Health, I think the Children's Hospital of Philadelphia does a really good job going over some of the questions and has kind of some of the experts in the field. And then California Department of Public Health, of course, also has really great resources.
And for both of you, what would you say about marginalized communities or those who are non-English speakers? Where should they get, timely and accurate info?
I would say similar places. Healthychildren.org is a great website that is in both English and Spanish and a number of other languages that really does provide some good information. That's often where I direct a number of my patients. Often your pediatrician's office will have education in different languages as well. I know that our clinics that are part of the LA County Department of Health Services all have those things. I'll have the information in multiple languages. And again, I think at the end of the day, talking to a trusted pediatrician is going to be really important. One who values that everyone should be speaking in their preferred language, should be spoken to in their preferred language, understands that that is a human right to be able to understand and be cared for in your preferred language. And the trusted pediatrician that you are seeing ultimately should be able to do that.
Thank you both. I think, one of the things that, as we get information, typically what happens is we'll share it with others. And so if you have really good information based on, good evidence and science, talk with your provider, talk with your family and friends about it. For those who ask questions about how do you talk to someone who doesn't believe in vaccinations, you just have the conversation. You try to understand, what their concerns are, what they're worried about. And it's really just about providing, good information for them to make the right choice for them. This all boils down to choice, but we want you to have really clear and strong evidence behind, you making a decision to do one thing or another. So really, a lot of this is a dialogue. It really is about, understanding what the concerns are. Even when parents want to do an alternate schedule, it's really a discussion, in terms of the reasons why, not to convince you to do something different, but just to understand what your concerns are with your child's provider or with yourself in order to understand, what risks may come from delaying it and what benefits you want to have by delaying it. This is all a discussion. It really boils down to your choice. It's not about trying to convince you or push you to make a decision. And that's what happens. As a provider, if I have a person who doesn't want to get a vaccine or doesn't want to take a medicine, we'll talk about that. And I may let it go for a bit. I'll bring it up again just to double check to see if things have changed. And that's the nature of the relationship between the provider, should be the relationship between the nature of the provider and their patient. It's an ongoing dialogue, that may change over time. But as providers, we're here to remind you when there are things that are recommended for you that you may not have done right now, and to always have a discussion with you from time to time to see if it may have changed for you and if now is the right time, because we don't want to miss that opportunity to do something that will prevent you from being sick, really sick, from getting an infection in particular. So with that said, I'll ask Dr. Gordon, any closing remarks that you'd like to say before we close?
Yeah, I think the thing I'd love to end with is, again, I'm speaking on behalf of general pediatricians. We want to have these conversations with you. We don't want you to feel rushed. We don't want you to feel forced. We don't want any of that. We want to meet you where you are because our goal is the same as yours, which is to keep your child safe. And we want to have those discussions so that you can feel confident in the choices that you're making.
Thank you. Dr. Yeganer?
No, I just want to express gratitude. I know that everyone here watching is really interested in keeping their loved ones and their families and healthy. So I do appreciate that they've taken time to kind of have this conversation with us and to listen to some of our perspectives. And again, I think that what Dr. Gordon said, talking to your trusted resources, including your pediatrician, your family medicine doctor, your pharmacist about these issues is really important. So I just want to double down on that message.
Thank you. And I want to say thank you to both of our presenters and to all of you for being here tonight. And to say that, it's really normal and healthy, to ask questions about safety and effectiveness. Every vaccine, like any medical treatment, comes with some risks, but those risks are carefully studied and monitored. And, even after a vaccine is approved. So we have a very strong system here in the US that collects a lot of information related to vaccines and any side effects that may come from it and how effective they are over time. So do expect that at times recommendations will change. Do understand why they changed and what was the basis for that change. And we're here to answer questions. So we'll continue to try to keep you up to date in terms of on our websites, maybe through other town halls, and through information with our community providers who are there always in the community to try to help answer questions, and with our healthcare providers who are there, including the pharmacists who are there to really answer questions and help you make a decision that's right for you. So thank you all for being here. We appreciate you, and have a